Sidewalk Labs is this amazing opportunity to bring a bunch of technologists together with a bunch of urbanists to take advantage of the amazing things that technology has to offer with a deep understanding about what really makes cities tick.
Instead of saying a problem is just about technology or it's just about policy, in most cases the answer is it's both. We find the very best people in the world who can go and think about solving those types of problems.
So first, let me have you help me welcome Manmeet Kaur. So I wanted to, just start and give you a chance to talk briefly about how you arrived at the City HealthWorks model and why you see it as so necessary, specifically around an urban environment.
Sure. Well, thank you again for having me, and it's a great group of colleagues that you brought to this conversation. So I'm excited to build upon some of these themes that both Lauren and Aaron brought up. So I'm from New York, and I spent 5 years working internationally on community health and workforce solutions in South Africa, India, and Sub-Saharan Africa. And I brought a passion both around how do you create jobs that are rewarding, that are fulfilling, that have dignity to them, along with a passion with how do you create a experience for people that actually responds to the specific need they have and makes it easier for them to access services that are already there. And so I started working on City HealthWorks 5 years ago when I began an MBA program at Columbia Business School, asking this question of, is there a gap that a person who's not a clinician, who's hired from a neighborhood, can fill? And if so, can I create a business case for that role and an operationalization of that role that solves pain points for providers? And so I looked at best practices and things I'd learned working for 5 years on these types of initiatives abroad, but also in the US, and said, what's been learned and what can we learn from and how can we do this better to create that financial case?
Yeah. Can you tell us a little bit about kind of how a City HealthWorks health coach operates, on maybe a day-to-day basis in terms of interacting with a patient, and specifically thinking about this, knowing that there's a lot of technologists, a lot of engineers in the audience, how your health coaches use technology to help what they're doing and facilitate the care they're giving?
Sure. So I shared a bit when we were chatting before. For us, my goal is that the technology is as quiet and invisible as possible. That the power of our intervention is a person who is taking the time and not saying, I've got 15 minutes before my next visit, or, I've got this list of 18 medications you're on and good luck. But actually saying, what is your goal? What are you, scared about? What are your aspirations? What do you want to be living healthy for? And you need to keep in mind, we work in environments where walking around East Harlem, seeing people in wheelchairs because they've had amputations is very normal. And so there's a sense of fatalism around why even care about trying to work on this diabetes when I've lost every family member who ever got diagnosed and watched them slowly lose limbs. And every one of our health coaches, when we interviewed them, said, I asked, why are you interested in this job? And they said, well, I watched my grandma lose her limbs and I don't want that to happen, and I learned it could have been prevented. So technology is about enabling an experience which is unique and often the first time for these patients to say, instead of being on the time and the dime of a clinician who understandably wants to do the right thing but is super busy, whether it's a nurse, a social worker, and enabling this person sitting in their home in an environment that's a lot less stressful versus the clinic. And there's a lot of studies that show when you're in a clinic environment, on average across populations, not even vulnerable populations, only half of information is absorbed. People actually only hear half of what they've said. Take into account people who don't speak English, 40% of our population, or people who are so overwhelmed, like the majority when they're faced with sickness, that they just don't have the, they go home and they're just as confused, like my mother. And so the technology role is about enabling us to build a network of these health coaches who are phenomenal and outperform medications and clinicians in self-management coaching. I can share our data there, to focus on that conversation. and then to take these insights that they're getting and to communicate it as smoothly, as simply as possible, so that our other customers, our other clients, our clinicians in the clinic who have very little time, who have so many different needs that they're trying to address, get the most needed, actionable information that we're able to provide in a way that they're able to actually look at and respond to. And so it's on the back end, because we're working with a population that's 13% of our clients rely on a landline. Those who do have smartphones or phones, their numbers change all the time because of the cost of maintaining phone plans. So the consumer side of this, whenever we have a client who's younger and uses apps, we immediately ask them, okay, we have MyFitnessPal, or there's other things you can use in addition as a tool. But what we're doing is sitting with them the first time to ask, do you know what that A1C means? Do you know what your asthma medication that actually are supposed to do? And first just understand, do they know what their conditions are about? And then figure out, do they know what their medications are about? Help them figure that out. And then from there, build that confidence to actually get motivated to become more independent in their care.
I mean, it's interesting that you talk about the prevalence of landline communication. One thing we think about all the time is the digital divide in cities, and being able to have something that approaches ubiquitous connectivity and everybody is connected. Would that type of ability, how would that change the way you're able to deliver care?
Having greater connectivity?
Yeah.
I mean, it's, a lot of most people have, also I should preface that a lot of our clients are elderly. We have a lot of younger clients too. And the younger they are, the more tech savvy they are. It is the continuity of having the same phone number, which every anyone here who sees patients or serves, delivers some kind of social service, there's not an easy tech fix. It's a cost issue. It's a cost barrier. And so that is, because we are in the community, our coaches meet weekly for about 10 times, and then we check in on people. So we essentially, are intensively in their life for about 3-4 months, but we know where they live, and we knock on their doors. If we don't hear back from them, we find out, we get to know who's in their household. We get those phone numbers. We do a social network kind of questionnaire at the very beginning, figure out who can we call if we can't find you. And so that takes people, but it also requires technology and the tool for the coach to be, and clinicians on both the system side as well as out in the community to be able to keep track of these movements and these changes. So I think the more tech savvy and younger the population is, irrespective of poverty, the more you'll find use of phones and internet. But many people in these communities rely on internet in the library, or it's just not at home.
Yeah, when you're
especially
talking
for an elderly population, just to qualify again.
That's interesting. You're talking about communicating the information that your health coaches find back to kind of inform the greater clinic's understanding of the problems. And you work closely with hospitals. You work with the city. So how does that integration take place in terms of the data you collect versus the data that's held somewhere else? And how do you see the challenge of coordination among all those various pieces?
So we structured this initially as a nonprofit that came in and said, we're going to offer this for free, and just give us your time, share, give us your data, give us your interest in are you interested in helping us do this together? And so with funding from Robert Johnson Foundation, primarily over the last 3 years, it was really the time and investment that clinicians, like some who are in this room, Dr. Esmond, one of them at Settlement Health, took to work with us and say, what is the gap from a clinician perspective that you feel is missing? And when we find information, how can we make it available to you in a way that you're actually going to be able to read? There's alert fatigue in the EMRs. Any clinician will tell you how many times, various part of the systems are sending alerts, but they don't get responded to. And so we had I'd say our success has been, and the number one question I get from community health practitioners across the country have been working on, doing community health delivery is, how did you get in the clinics? How did you get them to give your EMR data? So we have read-only access for our clinicians, not our health coaches. and our clinicians who are supervising serve as this bridge. And just to give you some data point, for every 1 in 2 clients, we identified a medical or a medication issue that was otherwise unknown, half of them which would have been an emergency room visit at that moment, and 40% of all of these were medication related, highly preventable, not necessary to be dealt with in an ED, like I'm running out of meds on a Friday. And so it is the relationship that forms with this coach where our coaches are the first person they call. And it's pretty quick, that trust. And when we work with, and the insights that we are then sharing are triaged by a thoughtful clinician who's saying, this is something I can handle and support the coach in dealing with, or it's something the coach can deal with on their own, versus they're about to go, they're developing a foot ulcer on their foot, we need to get them seen right away. And so this took careful, really persistent operational testing with clinics and saying, how can we be in your, part of the team here, physically meeting with you regularly and communicating electronically without being a disruption.
Yeah. Let me ask you here, as our time is kind of dwindling down, when you think about what you've built in just a few years and the challenges that you faced and you're seeing, how do you continue that momentum, carry it forward, and what are the challenges you see kind of in your more immediate term?
So it's a really exciting turning point where we've been 3 years in operation. It's been 5 years of R&D, of trying to bringing together the partners, figuring out the workflows. We're about to close on our first major contract with the health system in New York that's going to make us revenue positive in a year. That was the number one, goal. Initially, I was hoping to milestone. I will not say it's the goal. It is the milestone. It is the enabler, and it's a very exciting moment because we now have enough data that shows that after 10 weeks, we had a drop of $600 per member per month for patients who were not coming out of the hospital, but coming out of the outpatient. So these are a lot more stable. We're now going to be working with patients coming out of the emergency room and the inpatient setting and then also outpatient, but have enough data to show that it's working, and the workflows, and enough of the Dr. Esmond's out in New York saying, we want coaches, and demanding it of their administrators to saying, we want City HealthWorks for our patients, that it's an exciting moment, and we're now thinking very hard about the technology piece. We've built enough to operate at this scale. We've served 600 patients, and it is the next frontier for us is now the strategy, the resources, the partners to build software in a way that remains invisible for the coaches, as easy as humanly possible. Some of them came to us having never used Gmail before, so as simple and as easy as possible, and then integrated with the EMR. So right now we do a lot of manual communication with the health system. We are going to be we are becoming part of something called the Community Gateway and Health Information Exchange in New York, which initially will be manual, and we're going to make the investment to have it speak automatically with our system, so that these super rich insights, both the urgent and emergent ones that we can cover, like this person's developing a foot ulcer, or this person is, has an overdose on a medication because they were taking it the wrong way, versus this person is, hit their target of going from 3 cups of rice to 2 in a meal. Please, Dr. Esmond, encourage them to go from 2 to 1 and congratulate them from going from 3 to 2, because it's the specificity and the personalization of that interaction that the doctor can now have with this insight from the coach that is going to enable success, versus just saying, you really should eat better.
Right.
I know you're trying, but you should, it's going to really have an effect if you don't get better. And so it's being heard because the coach is also saying, they've gone this far. Let's work together to help them take this next step.
Right. It's about relationships, and as you were saying, technology enabling those relationships and being kind of in the background as they operate. Well, thank you very much, Manmeet Kaur.